welcome you all to this our end of project dissemination event. Every aspect of the health financing reforms that we put in place in Nigeria, we should always know that our position is going to shift tomorrow. Most times, the views we espouse are usually the views that reflect the position we currently hold. But we should remember that these health financing policy reforms, which was the cornerstone of this project, is something that will be with us till we enter our grave. So I want to appeal to you that even as we review the challenges, the successes, and the results of the last event, and as we plan towards this new phase of this particular project, we'll work with one thing in mind, and that is that tomorrow we'll become beneficiaries of what we have created.
It's such an honor to be with you today to celebrate what has been a partnership spanning many years, a partnership that really unites us in the joint objective of bringing quality, affordable healthcare to all Nigerians. Nigeria achieved such important milestones in the healthcare system. I was thinking back to when the National Health Act was passed in 2014. The whole global health community was watching. Can such a bold commitment be implemented? I was sitting at that time on the faculty of the World Health Organization Advanced Course on Health Financing, which I think many of you have been part of. We devoted a whole session in that course that year to looking at the act, understanding it, and debating, discussing how will this be implemented? Will it be implemented? Because if Nigeria can do this, it will mean so much for the global health community. Because Nigeria is a country that everyone is watching to learn from. So as it continues to push on and implement the health financing reforms, sharing the learning across states, across institutions, but also with your neighboring countries who are looking to you, and also globally, we're all looking to you. So on that note, I want to wish us all a very fruitful beginning today, not the end, beginning of the next phase of the journey and a new commitment to learning about how to take this forward in a way that makes good on the commitment to all.
This event is also an opportunity to share the highlights of the journey, the successes, the challenges, and the lessons learned, and the opportunities for further engagements. So NHIA is happy to identify with R4D as strategic partners at this event.
It's interesting to see that this journey has actually gotten to this stage. It started at a time when there was little or no belief how we could transition as a nation. But the good news is there's still that hope. And at this ceremony of the end of the project, it's also bigger hope and more interest to know that there is a scale up to it. And that means that you've done something very laudable, and that's why there can be a continuity.
It is not just about implementing a project, it's about result. It's about impact. The Federal Ministry of Health continues to cherish the contributions of partners who are genuinely committed to ensuring that healthcare development, healthcare delivery, healthcare management is delivered to all Nigerians with good dividends.
So we're struggling with a lot of things, and one of it was just putting together all the various ideas and thoughts that were coming from all different directions about how do we make this happen. And R4D was one of the first partners that was on board because of their own history in health finance, so we can help. And then I think we're having a lot of visits from the US team led by Amanda. My regards to her on how we could go about things and all of that. Then I used to get a call from them almost every other day. How's it going? What next? So at the point I was like, look, I can't do this. I don't need you calling me every day telling me what I will need to do next. I need boots on the ground. That's my constraint. We have the idea, we know what we should do, but it's a new thing. I was literally the only person assigned at the MPACD on it then. That's what I need now. I put boots on the ground. I need people here with me every day doing this work. And if they're doing it, they will tell you how it is every single day. And I must say, unlike most other kind of things we get with our partners, R4D responded literally immediately.
We also are privileged to partner with R4D. R4D is our core technical partner in Spark. Though Spark is hosted by Amref Health Africa in Nairobi, Kenya. And I think that a lot of lessons that are learned here through that channel can also scale across to other countries, as much as we can also bring experiences from other countries into Nigeria to help move things forward. So I'd like to say congratulations to my old and always existing family, R4D, to Dr. Hope specifically, and to the rest of the team. And congratulations to you all. Thank you very much.
Do we remember the Saving 1 Million Lives initiative? Who remembers that? Great. So R4D did the fiscal space analysis for that project together with Kelechi and Banji. We are in the, so it was then called Saving 1 Million Lives Delivery Unit, Program Delivery Unit, or PIU kind of. One of the things that we needed to address was the healthcare financing challenges that we have in Nigeria. In terms of health financing, we were not doing very well. Public expenditure, out-of-pocket expenditure, the coverage of people in terms of pooled financing or prepaid mechanisms, and of course, a lot of catastrophic spending was happening, and which was affecting the poor and vulnerable. So these were the realities as at 2017. So some of these figures, we left them there because they were the figures that we had about 2017. But today, I know most of you here who are in health finance will know that it is not exactly what we have today. And that is one of the celebrations or the achievements of not just this project, but all of us who have been working together in health financing, that where we were in 2016, 2017 is not where we are today.
Present an awards to the different agencies that we work with and different partners that collaborated with R4D throughout the journey of this Nigeria Healthcare Financing Technical Assistance Program. And to do that, I'm going to be inviting the Global Managing Director of R4D, Cheryl Cashin, to please join us, and the Country Director of R4D Nigeria, Dr. Hope Uweja, to join us here as we present the awards to the Federal Ministry of Health, NHIA, and the MPHCDA.